If you were just told that you have degenerative disc disease and cervical disc bulges, and you left that appointment feeling scared and confused, this video is specifically for you. In the next few minutes, I'm going to be telling you exactly what those words mean, what they don't mean, and what you should be doing right now. Degenerative disc disease and cervical disc bulges are typically two phrases that sound a lot more serious than they usually are. And note that I say usually, because while I do want to calm you down and give you a better idea as to what you are actually dealing with, I need to let you know that there are some cases where this might be serious. Allow me to break down what's actually going on in your neck and let you know the steps you should be taking advantage of today to get better. But real quick, tell me if this sounds familiar. You wait a couple of months to get the imaging done in the first place, and then no one even takes the time to sit down with you and tell you what's going on. You get a report, you read through it, and then you go home to Google what any of that means. And you're stuck between a lot of very dramatic, life-altering information or other people saying it's not a big deal, almost as if they're underplaying your pain symptoms. No one ever really follows up with you about it, and you're left wondering, is this something you're stuck with for the rest of your life, or is there any roadmap you should be taking in order to make your symptoms better? I see this at the office a lot, and degenerative disc disease is one of the most misleading names in all of medicine. Disease implies that there's something wrong with you, like it's something you caught. And it gives people this impression that it's going to continue spreading if they don't do something about it. But that's not what degenerative disc disease is at all. Degenerative disc disease is a term used to describe the normal degeneration of discs in a spine. Most people past the age of 40 have some amount of degeneration in their discs, and the thing is, most of them don't even have symptoms. A big thing to keep in mind, and to hopefully help put you at ease, is that your discs don't actually have a lot of innervation, meaning that they don't sense a lot of pain. They are squishy shock absorbers for your spine, kind of like the shocks you would find on your car. But they're even better than the shocks on your car, because when you break those on your car, you need to get them fixed. When they change in your spine and they're altered and a little degraded, that's normal aging. And I'm not trying to downplay or discredit your symptoms. The main thing that I want to bring to your attention is that I have a lot of patients who will come in with no symptoms at all, but when we get their MRI, it looks like absolute hell. And then conversely, we'll have people with a lot of symptoms and pain, and they won't have any issues or signs of degeneration in their cervical spine or the discs that are in between those vertebrae. The relationship in the condition of your spine and the pain you feel isn't one-to-one, which is just my way of saying being diagnosed with triple D is not a life sentence. It's just letting you know that your spine is changing, but what matters most is what you decide to do with that information as you move forward. What this doesn't do is it doesn't discredit your MRI report, scary as it may look. The thing that I want to do with you now is go through that not too scary injury scale and give you an idea of what that terminology means, whether it says that a disc space is maintained, that the height is normal, all the way down to triple D or a sequestered disc. That way you don't just have a report, you actually know what it says. Because for some reason, after you get those, it doesn't seem like anyone ever wants to explain it to you, so I'm here to help. Best case scenario, what you're first seeing is normal disc height, or a normal disc, just meaning that that specific joint space isn't showing any signs of degeneration. But a lot of the time patients will look and they'll see I have a disc bulge. And what that means is that you have a weakening on the outer portion of a disc. And as it weakens, it doesn't necessarily mean anything is squeezing out all over the inside of your body. Think of it kind of like the burger patty going a little bit past the outside of the bun. It's still contained, but it's just not in its normal orientation inside that annulus fibrosus, the hard outer portion of your disc. Now, as we go up that not too scary list, we're going to get to a disc herniation, and this is where that outer wall starts to give way and the inner squishy part of that disc, the nucleus pulposus, starts to protrude. And yes, this is where you are more likely to have pressure on a nerve, but these things normally don't need surgical intervention. It's something that can be managed conservatively, and your body's going to do a really good job of fixing that on its own. The herniation isn't necessarily going to heal and revert back to normal, but they're not meant to. They're shock absorbers. They are meant to wear out over time. And when they do, life goes on and you're okay. And then we have what's normally thought of as the kinkahunas, the extrusions and the sequestrations, where that disc fully ruptures. To put it into context, triple D falls before even a disc bulge. What degenerative disc disease really is it's kind of the environment in which a bulge, herniation, or sequestration is more likely. But one of the things that I always remember is that people younger than 50 are more likely to have a disc herniation. People older than 50 are more likely to have arthritis. And what that means is that the disc is doing its job. It serves as a shock absorber for the first 50 years of your life, and then if it hasn't ruptured by the time you're 50, it's normally just going to dehydrate and wear out, at which point you have more friction and compression between your bones, and you're more likely to develop arthritis. Which I know sounds scary, but frankly, it would be a lot more weird if I saw an 80-year-old with no arthritis. It's just part of aging. With that in mind, I understand that nobody wants a disc bulge or a herniation or a sequestration, but how you should think of degenerative disc disease is like a caution light at an intersection. It doesn't mean that herniation is inevitable, but it means what you do moving forward is going to be all the more critical. So let's go through the 4 steps you should be doing today to make sure that you're healing correctly. The first thing I would highly recommend you do is get an actual assessment from a physician, either a physiatrist, a physical therapist, or a chiropractor. Because one of the things that an MRI is never going to be able to do is give you hands-on information and assessments of what's actually going on in your neck, be that the joints, the discs, or the muscles. You can definitely still use your MRI report, but it should be used in conjunction with actual findings. What are they feeling in your neck? What do they see in terms of strength and weakness? Do you have neurological symptoms that don't correlate to what's shown on that image? And all of that together will actually let you know what's going on. The second thing you need to do is start gentle. And what I mean by that is to begin exercises that are gentle for your neck, because what I most commonly see here at the office is people quit moving to avoid pain altogether. And then what ends up happening is those muscles that are already tight start to guard, and the weak muscles that are messed up start to atrophy. So doing nothing makes your problem worse. And if you're not sure where to start with that, go down into the description. I have a free link for the first module of the Cervical Disc Recovery Blueprint, where I'll be showing you exactly where I would start with 3 safe and effective moves to get that neck moving without the risk of further injury. A nice, easy third thing that you can do is assess your posture, because a lot of people hear degenerative disc disease and they think, oh my gosh, this is something that my parents had. It's contagious, it's genetic, and it kind of is in the sense that your parents probably also worked a desk job and they stared at a screen for hours a day. And even though it doesn't seem like much, that anterior head carriage, that slight lean forward that you get when you look at your monitor of 2 or 3 inches, substantially increases the load on your cervical spine. And that's going on for the entire 8 hours that you're at work. Then you compound that with the fact that most people don't know how to set up their pillows properly when they sleep, and that's another 8 hours your head is in a compromised position, increasing damage on that cervical spine. Think of it kind of like death by 1,000 paper cuts. It's not so much that you did one major thing wrong, like a motorcycle accident. It's that you do a tiny thing wrong 16 hours a day. And then finally, one of the biggest contributors to people getting aggravated with their symptoms is having a realistic time frame for your recovery. Because so many people think that a disc is just going to heal in 3 to 4 weeks, but disc recovery is measured in months, not weeks. Just to try to give you some rough estimate, if you're actually struggling with a disc bulge, you're looking at about a month and a half to 2 months for the pain to subside and to get some strength back, 2 months to 4 months for full stability. And that's if you're doing a conservative treatment and pacing yourself so that you don't re-aggravate symptoms. In the case where people go and get surgery every time that they find out they have a disc, you wait about a month or two before you even have the surgery. Most of the time, no one does any kind of PT beforehand. You have the surgery, and then you undergo about 2 or 3 months of physical therapy. So your best bet is to just start with physical therapy for 2 or 3 months, realizing that it is going to take time. And that's all well and good, but it brings us to our next point, which is 3 urgent to-don'ts, things you need to stop doing for your sanity and your recovery. To-don't number 1, quit Googling your symptoms. You're driving yourself absolutely insane, and honestly, you're just ramping up your stress, which not only does cortisol increase pain sensitivity, but if you hold your stress in your neck, you're shrugging up your shoulders, making those tight muscles even worse. To-don't number 2, quit doing neck rolls. I have no clue what monster ever told anybody that this was a good idea when you have disc degeneration. Also, those circular stretches where you tilt your head and you pull as hard as you can, all you're doing is putting unequal pressure on that disc, sort of like you're trying to figure out how to make it pop. And even if the disc isn't what's causing your pain, let's say it is coming from a muscle, tendon, or ligament, if it's strained or torn, the last thing you need to be doing is stretching it, because that's just going to make the tear worse. Finally, to-don't number 3. Don't wait, because a lot of people get waiting and resting confused. They think, well, if I don't do anything and I let that muscle relax, it'll heal. And sometimes that works for a sprain or a strain, but in the case of degenerative disc disease, what's causing that is actually an imbalance and weakness in those muscles. And if you never address that weakness, it's going to stay there. Even if you quit moving, those muscles are going to atrophy equally, meaning if one muscle is twice as strong as it needs to be and another muscle is half as strong as it needs to be, your inactivity doesn't change that at all. Which is why, going back to point number 1 of things you need to do and going to see a physiatrist, a PT, or a chiropractor, a big point of that is for them to assess which muscles of yours are imbalanced. And when you do go to that PT or chiropractor, and again, the sooner the better, a general time frame is going to look something along these lines. Weeks 1 and 2 is just decreasing the nerve pain. They might even be taking you through some passive ranges of motion. We just need to get some movement in those joints without agitating any symptoms and increasing blood flow to the area so it can start to heal. Weeks 3 to 6 is typically where things start getting a little more challenging because we're going to start to progressively load your cervical spine, targeting those deep cervical flexors and trying to relax some of those overly tight muscles like your scalenes or your upper traps. This will be a combination of 1, getting your body to learn what movements are safe to perform without sending a pain signal, but also getting you to understand how it feels to have a controlled motion of that neck and when your neck is engaged versus when it's loose. And then by week 6 to 12, we're in the functional recovery stage where you should be back to your normal daily activities. The main thing we need to focus on are that your postural reassessments are in place, that monitor's in the right spot, you have a good pillow that you are using properly. But here's the thing. Degeneration is an ongoing process, which means your recovery from it is an ongoing process. You never fully graduate. You need to maintain the strength in your neck because the things you did to get you in this position, your job, your stress, how you sleep, are all tiny accumulations of seemingly insignificant stuff. And in order to counteract that as you continue to live for the next 40, 50, 60 years is with tiny exercises that help to maintain the balance that you've spent the last 4 to 6 months working so hard to achieve. So, to recap, degenerative disc disease is not a death sentence. You are not stuck with it. A lot of people recover from it, just like you. The main thing is taking the right steps in the right order as quickly as possible. Finding a physical therapist, chiropractor, or physiatrist to actually analyze and assess your neck. figuring out the imbalances in that neck and doing the right exercises to strengthen them, and then also looking at your desk ergonomics and your pillow to figure out if you don't need to make some changes to limit the aggravation that led to that degeneration in the first place. If you're in the Brackenridge area, I would love to work with you in person, but I also realize that most people aren't living in Pennsylvania. And that's why I made the Cervical Disc Recovery Blueprint. It's an entire program you can download down in the description, which takes you through the first month of recovering from a disc herniation. In that program, we're taking you all the way from getting your neck to relax, how to progressively load it so that it gets stronger, and how to train getting back to your day-to-day activities so that quick head movements and driving through traffic doesn't aggravate symptoms like pain, dizziness, or nausea. So if you're hesitant to seek out a PT or a chiropractor near you, check out that program and I'll be right there with you in your own home, guiding you every step of the way. And with that, guys, I'm Dr. Beck. Thank you so much for watching. I hope you found this information useful, and if you did, please share it to somebody who could also use this information. My job with this YouTube channel is to help as many people get out of neck pain as possible, and the best and easiest way to do that is if we work together to help people learn this information. Thank you again, and I will see you in the next video.